Okay. Welcome everyone to another CTFSN chat. I'm April Dipollina and I work in Southeast Connecticut. Today, I want to talk about a program called the Medical Home. The Medical Home is a statewide DPH funded program. Here in Southeast Connecticut, the program is run by United Child and Family Services, known as UCFS. UCFS and the Medical Home offer families raising a child with a disability many services. So today I have two people from the Medical Home program. Norma Glover, Medical Home Care Coordinator. Was that correct, Norma? Do I have your title right?
Correct.
Okay. And then Patti Passmore, who is also a Medical Home Care Coordinator. Thank you both for being here today. I'm going to start with Patti, and I just want to give you a little background. Patti and I have been working together, I think, for 15 years, thereabouts, with the Medical Home program.
Yes.
Patti, it's about 15, right?
It's actually 12.
Oh, my goodness. Okay.
Yep.
So I'm aging us a little. Okay. I'll tell you, Patti is hands-on, frontline, working with families. And so, Patti, I'm going to start with you and let you, the three things we want to accomplish today with this chat is getting information out to everybody about what the services are at the Medical Home, how they're doing these services, how we're delivering the services in the middle of the COVID pandemic, and then what's it going to look like as we make plans to open. So I'll turn it over to you, Patti.
Okay, thank you, April, and thank you for having us both here today. We're happy to talk about the program. I have been with the program in this area actually since it began. It is grant funded, as you said, by Department of Public Health, and it is through the Title V program. And because it is a grant program, they do dictate what the program looks like. And I don't mean dictate in a bad way. I mean, they just really give us the guidance on how the program looks and how the services are delivered. It is meant to be a resource it is to build a partnership with local pediatricians and families to connect them to resources more on a local level rather than that state level of services. Because as we know, Connecticut is kind of a spread out state. And even though some of the services that families need may be centralized in Hartford or other places, a lot of families need to know what they can have and obtain right in their own community. So we try to connect families to any services that are available as close to home as possible. And it all is information to help them improve their child's health outcomes. So we get referrals mostly from pediatricians. That's what our kind of our baseline. We work with them on families have gone to pediatricians and asked questions or needed something, and pediatricians are referring to us. But we also get referrals from families themselves. We also get referrals from places like Connecticut Medical Center, Connecticut Children's Medical Center, and a whole variety of other places. But the purpose is to help connect and coordinate some of these services together and try to keep things as much on a local level as possible. The wonderful addition of Norma being here is that Norma is bilingual. She has made it so that we are connecting a broader range of families, and we also use language line so that, you know, here in the eastern region of our state, we have a very diverse population. We are having many kinds of families because of the casino. We have a lot of different languages that we work with. So we're trying to help parents get and obtain all the services that they need. We work and partner with many other agencies. I have, as April says, partnered with her over the years, working with trying to connect parents to support. That's the biggest issue I see is that parents tend to get isolated and we like to see them connect. I can sometimes be a first connection for parents, and we kind of talk about doing a family needs assessment. You know, what do you need today? What is it that you need to be connected with? And then we might talk about connecting them to places like Birth to Three, CPAC is a huge organization that we partner with depending on what issue has been identified for that parent. And it might be that they need help with navigation. Navigating different systems is huge for parents. It's just something that parents will get overwhelmed with: paperwork, applications. They're told they need to apply for this and, you know, go on and get this service, but the application process can just be so daunting. Norma, you want to say anything about any of that?
Yes, especially we do see that English speakers have especially a challenge with completing and understanding the system, which a lot of times if they're coming from different countries, they don't have the background for that. So we provide the guidance and support that they need in order for them to get the services that their children need.
There may be things, one of the things that Norma has as a real strength is that a lot of people need help navigating the insurance, you know, that whole SNAP, insurance, all of those kind of resources. As you talked about all of the issues that we're dealing now with the pandemic, people have lost insurance. People are in need of food resources. Norma has been such a wealth of navigating families to what do you need to go look for? Where do you find this information? Some of it is easily navigated, but some of it is, you know, I just need a phone number. I need to know what paperwork, how do I download this information? How do I get that information to get my family's sometimes just basic needs met? And that is something that Norma has really been able to find these resources. They're out there. We just not are always easily obtainable.
So let me just jump in there for 1 second. I want to add the parents' perspective on that. Both your organization and mine before yours was started to help families access information easier. Because as you mentioned, Patti, isolation is one of the biggest things that happens to a family when a child with a disability is brought in. And where do you go to get services? It's really hard, and it takes a lot of time to try and be doing that on your own as a parent. And as soon as you can connect with one of these organizations like the medical home, like the Connecticut Family Support Network, that is what we help you do. And that's why partnering, we work so well together. Each organization, and there's many more out there, a lot of them have their expertise. And so a lot of times as a family member, you don't know who to call, where to start with. But if you reach out to, say, Patti, when a family reaches Patti, maybe all they need is they're looking for a resource for an activity for their child. And they may call me, and I have a play group that's going on. So it's a lot of partnering. And the biggest thing, and also what you said, Norma, about families having to find out how to do those applications and that, it is that we partner together, and it takes away some of that isolation, and our goal is to make it easier for the families. And I think we do that as we partner.
So what I have found, April, is that because neither one of us is able to case manage, it's a term that's often, you know, I often get calls from people and saying I need a case manager, and the specifics of my grant, we are not able to do that. But we do start with families with talking about something of some organization of paperwork, some immediate planning with families, some long-term planning with families. And which is why I often love to connect them to Family Support Network. Like I start them on a path, and it's a journey. And Norma and I both always talk about directions binders. It is an organization tool. We still, even though we're a computer generation and everybody depends on computers, we have it in English and Spanish, and parents can organize their paperwork to feel like, okay, I got this information together. Many providers are going to ask for this information. It makes it a little less overwhelming. And as they go through their child's journey, it helps them. Today, this is what I need. This is what's going to happen for us today. But tomorrow and the next thing that happens, I still have the information. I have what's needed. It's as best as you can do for the journey to keep as organized as possible. Now, I always also say, you know, we do the best we can. We all do the best we can today, and then tomorrow we hope to be the next best thing. It's just that these are tools and resources to help families. And I have found that when they start with me, I connect them to the Family Support Network. They are continuing to get information that help them to, what is the next step that I need? This is the one thing I did. 6 months from now, what might be the next thing? And many parents have called me back and said, I got through this. This is what I got from that. Now my child is in this place. What do I do now? And we're able to get through the next phase. So it does work out wonderfully. And we might need another organization to use and to find out what my child benefit from. So it's wonderful to know our region is rich in resources. It's just that we don't always know where they are.
And let me just say, again, parent point of view, true of raising any child, typical, if you will, or a child with a disability. What you need when your child is birth to 3 is not the resources, or are not the resources you're going to need when that child is in elementary school, middle school, or going to college. So you do the planning, and that directions book, I've used this with families. I've had one myself. It changes as you go through the different stages. Birth to 3 got put away, and the next step was filling it with the school system, and it was different organizations. While we entered school, we were in constant contact with an organization called CPAC. And so you're right, this is a living book. It changes as our lives change. But as you said, Patti, we may need another organization when we're at another stage. And again, that's what we try to do, is point you to, connect you to those organizations.
So as we have worked through this pandemic, a lot of us are working from home. We are still working with parents by phone. We're able to still care coordinate. We're still looking at removing barriers for parents to get their child's needs met. We are all facing some real difficulty in, having the challenge of, it may be good for some parents to have telehealth visits, but it's also a challenge to do telehealth visits. But at least that is what we are trying our best to deal with. It is sometimes it's still that connection to our specialists. We are seeing that some are starting to open back up. Some specialists are starting to open back up. We here at the health center where I work are very slowly starting to open up visits to first well children. They do see a lot of children still sick visits by telehealth, but for us, we are still keeping everything by phone. We have been able to manage assisting families with connecting them to the resources, but we are following CDC guidelines. We have to follow DPH guidelines until, and of course state guidelines, and we will do the best we can to continue to serve families as best as we can. The calls we get are a little bit different, but they're not a lot different. Parents basically are just looking to make sure their child's needs are being met. So we do still try to just kind of do an assessment with them as best as we can and serve them in the best way that we can. Resources do look a little different, but we're trying to adjust to those needs as well. In whatever town you're in Connecticut, there is a medical home program. It might look a little different in whatever region you're in. There is a medical home website under Department of Public Health. So if you go to the DPH website, you can look for your medical home nearest you. So that is definitely a resource. But if you have a special needs child, you can access it. One of the things we also help families do is something called a respite application. It's not, we don't provide respite, but there is a respite application that parents can complete. And we help parents, we facilitate that application.
So Patti, let me move us forward a little bit, and you touched on it. First of all, we are all following the CDC and Governor Lamont's guidelines. The network too is working from home, and there's not any, we've done a lot of services online. We've done groups with Zoom. We have a lot of parent support groups. We've been doing Zoom meetings. What is it going to look like as you start to open? So you said the clinicians are starting to open up. Well, it's a twofold question. So if you have any actual draft of the steps, I'd like to hear those, like if the dates. I know that the 20th is a big date in the state for opening more services. Camp Harkness, I might as well mention that now, is actually opening today, but with restrictions. No more than 50 people in, they're going to check at the gate. It's only for light activities. A lot of the facilities aren't open. It's basically just for walking and activities like that, walking through the park. You can get more information at the camp, but that's the kind of thing I'm talking about. If you have any actual deadlines or dates. And then the other thing is, I know I've learned a lot. We've learned a lot. Is there anything that you have learned through all this online and working from home that you think is going to keep going moving forward?
So we actually are just doing it in such very, very slow phases. We are not doing any face-to-face, probably still for quite a few weeks. So everything for us personally here at the health center will be by phone that we know of. And it's because they are still being very cautious. As far as I can tell you clinically, what they're doing is they're just calling back patients on a very, very limited basis. And that it's by trial. So until they see what that looks like, they're not going to be making any other decisions. So we don't have confirmed dates.
Okay, so you don't even have a blueprint yet, which makes it understandable. The last thing we want to happen is for not to take baby steps and go cautiously and get us all into more trouble. So,
Right, April. And to just add to that, it's just because there is still a lot of uncertainties as well. I mean, we are a little bit over 3 months into this pandemic, but it was really a curveball to all of us, and families with children that have special healthcare needs know all about that. So we are learning, we are evolving, we are taking what we know right now. So one of the things that you said, what have we learned and what will we keep? I think telehealth has definitely been a savior to a lot of families, because at least they're able to connect to their clinician, to therapy, to their doctors, and that is something that will continue. I know it's not accessible to everyone and is not ideal for everyone, but that is one of the services that we plan to continue here, in addition to having in-face interactions that will slowly come.
You make a really good point about telehealth, and I think we're all over the board with this. I know my husband has been struggling with telehealth appointments for himself with his doctors. But as we were speaking, as a parent of a special needs child, I'm thinking for some parents, this may have been a real blessing. Like you can't get clinical, you cannot get your teeth cleaned if it online, obviously. But if you have one of those children or you're far away that has a lot of anxiety of going to the doctor, or you have an hour ride, if it's something that you can do discussed and relaxed like we're doing now, I bet, if not for my child, but I bet for some families, it has been a better situation for some things. Cannot replace everything. And so yeah, like you said, Norma, I think there's some good things to be taken away from this. Certainly we're learning, and in retrospect, we're going, as we all hash this out, we will know some of the things that absolutely failed. And, but those that have been positive, we even did our play group, which Patty's been to. Norma, have you been to the play group? You came, didn't you? Yeah. So we actually did that online, a music therapist, just like we're doing now, and music and kids responding and getting individual attention. I won't say it replaced being at the beautiful beach, but we were able to keep it going. Anything else you two want to add specifically?
So, we're looking forward to, whatever is to come. We feel, the message is always, there's always hope. There's always good things to come. We will learn a lot of lessons from this. You always have to keep the faith. But there is one thing that's going to be happening that's a little bit different for us particularly. Mm-hmm. As of June 30th, I will be retiring. Norma will be taking over. But I can never leave this yet. I am going to be working just a couple hours a week, so that I still have my, I just can't leave families. I still want to be part of this, but I feel like I'm leaving this program in such good hands. Norma has really done such fantastic things and such wonderful work. So she will be, if people call medical home after this, they'll be getting Norma. So it's going to be good. There's hope and sunshine in the world.
That is so wonderful on a number of levels. Well-deserved, Patti, absolutely well-deserved. I'm thrilled you're staying involved. I know you'll be there. And you couldn't be passing off to a more competent, compassionate individual. Our paths have crossed a little, Norma. I look forward to working with you. And this is good news all the way around for the medical home. What I'd like.
Makes it easier.
What's that?
It's what makes it easier.
Yes, yes. Knowing that it's being passed, the baton is being passed into good hands. Well, I just want to say for all our viewers, I hope this has been helpful. If you need more information or you want contact information, it's all on the Family Support Network website and on our Facebook. We have links to the medical home where you can get in touch with Patti for a few days and Norma moving forward. I thank you both. It's wonderful to work with you, and let's hope that we just keep the momentum going forward. Thank you both.
Thank you. Keep smiling.
You too.
I have to fix my computer.